Suffolk and Middlesex. Mr. Brownsberger.
I rise in support of the amendment also. What I'd like to emphasize is that I see this amendment as now redrafted as being entirely consistent with the main thrust of the legislation which you have shaped. I believe that this body and the governor in 2006, when we passed the health care law, or whenever it was, 2007, took the right strategy to get to access, to get to universal access. And I believe that now this body has very wisely chosen the right strategy to get to cost control. The creation of an agency, the creation of some targets, the creation of some sustained downward pressure on costs, and at the same time, a motion towards accountable care organizations. So I strongly support what this body is doing in this bill. If you squint into the future and imagine that we're in fact successful as a result of this bill, you can imagine a set of major accountable care organizations in this state which combine most of the needed services of health care and are competing with each other to provide services to patients. I believe in that environment a single-payer framework that supported competition among those, continuing competition among those major organizations for the business of individual citizens with a public finance component is the right way to go, and it's the way we would like to go for the reasons that the senator from the Cape and Islands stated. I think that's the reason we want to get there, is because we've got a strategy for access, we've got a strategy for cost control, and if we can take the burden off of businesses, we will create jobs, and we will particularly will do much better at creating low-paying jobs, which I think is one of our key goals. So, as drafted, this legislation just keeps that conversation alive. This amendment keeps that conversation alive next to the central wise strategy that this body has shaped for controlling costs. So I support the amendment, I support the bill, I support the direction of the Senate, and I believe they're both entirely compatible. I hope the amendment can get fair consideration and is in fact adopted.
Thank you. From Worcester, Hampden, Hampshire, and Frank.